So complex regional pain syndrome is a very important condition that can be missed in diagnosis. So we see in our practice many patients who come missed the diagnosis, been in the community for 10 to 15 years where nobody diagnosed complex regional pain syndrome, or it can be misdiagnosed as a complex regional pain syndrome while it is not a complex regional pain syndrome. So very important to know the condition and how to diagnose it to be very accurate in the management. So it is a neuropathic pain disorder. It has a pain disproportionate to the degree of the tissue injury. That's when the patient will start having sensitivity to touch, sensitivity to pressure, unable to put their clothes on. And it has sensory motor autonomic abnormalities. And there is typically, most of the time, there is a reason. It follows a fracture, a surgery, or some sort of an insult to tissues.